Hi, Donald. I just finished watching your presentation, and I have to say, very good job. As I'm sure you guessed, had never heard of this particular illness before. Everything was brand new to me, but you did a great job presenting everything. You explained why it's something that matters to you where you live and how you see it frequently there. And then you even described how often it occurs in other places. I'm surprised to hear that it has happened in the United States. I've never ever heard of it. So great job on that. Um, Particularly, I want to say, well done on the way you really went into detail describing like the hows of the disease. How does it affect the heart? How does it affect the action potentials? All those things. That your videos were fun, they were descriptive, and they really explained it well, even to someone who doesn't deal with cardiac issues often. So excellent job on that as well. If I were to say anything to work on, it would be maybe include a couple more citations in some of your slides. For example, just I know a lot of the things you showed were probably just things you know from your experience. However, maybe just some citations for the like the action potentials for the heart, the functioning of the heart. Just throw a textbook citation in there or something might be useful. Um, and then the only other thing is just, as you know, it was a little long. That was hard for me too. Mine was too long as well. So I guess that's something for us to work on as we move forward, is to try to kind of keep it within the range that it needs to be. Um, your case study, I thought, was very effective. You used a real life example that you personally have seen to illustrate how the disease presents, signs and symptoms, as well as how it can often be mistaken for other things. So that was a real great example, particularly for someone like me who lives in the States and doesn't see this. And particularly, I work in labor and delivery, so I probably never will. But for someone who could come across it, someone who works in the emergency room or something like that, since it's been in New York City, it certainly could come up here to Connecticut where I am as well. So I thought that was a very effective way to illustrate what you were talking about. You also did a great job explaining the differences between why epinephrine didn't work for the patient, but why atropine was the right choice. You clearly have a great understanding, a really good grasp of the medications and the area in which you work and how to properly treat your patients. So bravo on that. And since there's not a ton that can be done, since you can't, like you mentioned, you can't test a fish, you can't know what's been infected and what hasn't, and you can't kill it by freezing. I mean, all those things. Clearly, there's not a whole ton that can be done to help prevent it, but you still, kind of spelled that out, what can be done. Don't eat the reef fish, educate the population, don't eat fish during warmer seasons. So even with what little there can be done, you did a good job trying to illustrate how people can prevent themselves from becoming sick. Your presentation skills were great. You had good eye contact. You clearly felt comfortable speaking with the camera, comfortable talking about everything that you did. So very professional presentation, great details, clearly a great command of the topic. So overall, beautiful job, and I look forward to seeing more from you in the program. Thanks, Donald.